So a very good morning to everyone present here. I am Dr. Nishi Satish. I'm a senior resident at Safdarjung Hospital. Today I'll be talking about a case of neurofibromatosis 2. So neurofibromatosis 2, we know it's autosomal dominant disorder characterized by the involvement of the Merlin gene on chromosome 22q. There is basically, the salient feature is that there are bilateral vestibular schwannomas in this, and the ocular involvement in this is either through schwannomas, meningiomas or ependymomas. We had a case of an 18-year-old male who came with us with the progressive painless loss of vision in his right eye first, and then later he developed proptosis in the same eye in a 5 years duration. The patient on examination, when we saw him on general physical examination, we saw that he had multiple subcutaneous nodules present all throughout his body, and he had a spinal deformity, he had scoliosis, and there was sensory neural hearing loss. On ocular examination, he denied the perception of light in the right eye, and there was abaxial proptosis of 5 mm and a vertical dystopia of 1 mm. The extraocular movements were limited in dextroversion and dextroelevation. And when we got an MRI for this patient done, we found that we did a CE MRI first because we wanted an integrated approach. There were two areas of interest here. Anteriorly, we found a contrast enhancing mass in the right orbit, which was involving the right optic nerve, extending up to the tip of the optic chiasma. And posteriorly, when we saw the same axial scan in CE MRI, we found that there was a contrast enhancing mass in both cerebellopontine angles, which was enlarging both bilateral internal acoustic meatus. So this was highly suspicious of bilateral vestibular schwannoma, and an integrated approach, like I said, had to be taken up. So in our case, we did an anterior orbitotomy and took a biopsy, and we found that it was actually a neurofibroma. Now, when we see a patient like this in neurofibromatosis 2 with primarily loss of vision, we suspected that he might be having a meningioma. But we found that there was actually a neurofibroma of the optic nerve. Now, neurofibroma or vital neurofibromas can be seen in neurofibromatosis 2, however, they are quite rare, and they are mostly seen of the frontal nerve. So finding a neurofibroma of the optic nerve in neurofibromatosis 2 was actually quite rare. So this case is unique because the histopathological features were different, the presentation was very long-standing and different, and although genetic testing is not needed for the diagnosis of this patient, it is advisable so that he can get genetic counseling done later on. So with an integrated management, the patient had to undergo a gamma knife surgery to prevent the spread onto the other eye because the optic chiasma tip was involved. So with this, at least the other eye was able to be salvaged. These are my acknowledgements. Thank you.
Thank you. So when patient came to you, he was never been diagnosed ever?
Yes, ma'am. This patient presented to us. He lived in a village. He came to us after 6 years of not being able to see.
Okay. So those skin lesions, it was never diagnosed earlier?
No, ma'am. He came to us primarily in ophthalmology, and because we suspected neurofibromatosis, he could be diagnosed with other things like sensory neural hearing loss as well.
So that's what's coming to that. Were there other features that
Yes, sir. Like we said on general physical examination itself, we were suspicious that he is not able to reply as we would suspect a normal person to reply. And when we got an ENT consultation done, we found that there was sensory neural hearing loss.
he was unaware of the hearing loss?
He was not aware. He was a neglected patient, sir. We have them in Safdarjung Hospital, sir. We get many.
Yeah, nice case, nothing much. I mean, I think you highlighted the importance of, again, doing a good examination and then subsequent investigations. Only thing about the genetic testing, and see, this is a very clear-cut case, and
Yes.
you really don't need a genetic diagnosis, and you don't always need a genetic diagnosis for a genetic counseling as well. Okay, he can still undergo, because conditions like these, Marfan's and all, you have criteria which will diagnose
Diagnostic
in the
criteria, yes,
absence of
ma'am.
genetic
Clinical
diagnosis and genetic testing, so that can still be done for him.
Okay. Noted, ma'am. Thank you.
Okay.